something.
Now, the president, though, Congressman, has said in many different occasions, if you like what you have right now, that will not change. You will not lose that. How come that message is not getting through?
Well, let me nuance that a bit. You will not lose it because of the new plan that's being proposed. The insurance, I call it insurance reform. It's not healthcare reform. We're still having all the private doctors we had before. The only thing we're tinkering with is really the insurance aspect of it. And you won't lose the plan you have or the doctors you have because of anything we do in this plan, any more than you could lose them right now with the insurance companies.
Right, or if your company changes insurance companies.
Your company can decide if they're paying 50% or 70% or 20%, they can decide to pay only 10%. If they decide to drop insuring you altogether, unless they have a contractual obligation, they can do it now. That's what the real concern is, that your company backs out, that you lose your job, that you're transferred to some other state or get a different employer. What happens?
If you have a pre-existing condition, good luck getting another company to cover you. Jerry, I asked Congressman King last night after the speech, one of the first things that President Obama said right out of the box last night was, you know what, the game playing's over. You know, no more bickering, let's stop, no more playing games. And when I asked Congressman King if he thought that was possible just because of the climate, the political climate in Washington right now, one of the things he said was, hey, that's what politics is all about, a healthy debate. Because we're not bickering here, we're debating the issue. Can the two sides come together on this, Gary?
There's a difference, Lee, in debating the issue, where you have a point of view and someone else has a point of view, or you have an amendment that makes it better and you think someone else is going to make it worse. There's a difference between that, which is real debate, and we need that on a vigorous level in any real democracy, and that's what we should be having. The thing that we've found what we're really getting is those people who don't want to debate, who don't want a town hall meeting, but they want a town hall meeting that they can disrupt, that they don't want anything, and that their game plan is not to make a better bill, but to sabotage the whole process because they want the status quo. The rest of us, specifically on the Democratic side, that's proposing this change in the way the insurance industry operates and the rationing that we do have, that they do, is by having some kind of public option or single payer option, if you will, that the only thing it does is it takes the insurance company, this is the public option part of it, that's been the big controversy.
Yes, biggest controversy.
It takes the insurance company out of it, and it says the government will pay the private doctors that you have. That's it. The government doesn't have to make and if it's one thing that the government can do, and you could argue what government does poorly or not as well as it should, but one thing the government does do well is it sends checks out on time. People are very happy. If I said I'm going to have a proposal to have the insurance industry as the intermediary in your Social Security, and they'll decide whatever or whenever, instead of the government sending out the checks, and they could make a $20 billion profit at it, which will come out of what you're receiving, people will say, what are you, nuts? What we're saying is, if the government sends out the checks, not for everybody, but for those people who are uninsured right now, as the president said.
And who have chosen it.
And who choose it. If you don't want that, listen, they're figuring that a small percentage of people, 5 to 10 million people, would go with the government option if there were one, and there's 46 or 7 or whatever the new census numbers is going to show today that they're coming out with. There's a new number today.
Even a new number, okay.
Yeah, but it'll be in that ballpark, or probably a little bit more than that, 46, 47 million. That if only 5 or 10 million of people take, where did those other 47 million people getting their insurance? They're going to pick the private sector. They're going to pick the system that we have now, and that's fine. There's some people that'll swap. But this will be somebody's choice. It doesn't force you to take the government option.
So it's not, as some people have pointed out, in your opinion, a government takeover of health care.
It's the government substituting for the insurance company that's now rationing your health care. And you will have the government, if you have the government option, ration your health care. It's being rationed right now. This is covered, this isn't covered. You can have so many visits of this and not of that.
I mean, Jerry, that is true. Welcome back to Long Island Talks. The president's speech on health care, very much the topic of conversation in political circles as well as across the nation today. Joining me here, Long Island Congressman Gary Ackerman and News 12 Long Island political analyst Jerry Kremer. We go to the phones. Michael from Rockville Center is up first. Welcome, Michael.
Thank you, Lee. My take on it was I was a little disappointed.
Okay.
Whenever I hear, and wouldn't single the president out, but any elected official who promises us to be able to save money based on ridding the system of waste and fraud, I'm always suspicious of, because he could sound like any governor of any state, in particular, especially New York State, where they're always promising to save us billions. The second issue I would point out, just very quickly, because I know you have a lot of callers, is just the fact that I'm going to call the congressman on it. I think he's being a little disingenuous. There's 46 million people alleged not to have insurance, but there's 20 million who are offered insurance but who reject it because they're in good health but want to save the money. Another 13 million who are possibly illegal immigrants. So those issues weren't addressed last night, and I was disappointed with the president.
Right,
He's
Michael,
different.
Thank you, Michael. I appreciate the call, and I'll let the congressman respond to that.
Well, first, Michael, the illegal immigrants are not given the option of getting into this program, just as they're not in afforded health insurance right now. So they are in none of the equations. We've left out the illegal immigrant issue. We left out the abortion issue. We left out all the controversial stuff. So we could deal with this. We'll deal with all of those issues separately. So these are people who, for whatever reason, are uninsured. And whether they've elected not to take the insurance or not because they think they're young and healthy and invulnerable, they still become a burden. And the president did make this point. They become a burden on society when they get, unfortunately, sick or stricken with something that's very expensive, because that cost is put off to the rest of us who are paying right now. You, Michael, and Lee, and myself, and Jerry Crema are each paying over $1,000 a year to pay the bill of that person who decided that they were healthy when they do get sick. That's where that huge cost of the emergency room, you know, we're paying full bore the cost of the emergency rooms. If you're making a choice, as I did, as so many people do, to take health insurance for their family so that their kids are covered and their families covered, because it'll be cheaper for you to do that, to insure all your dependents rather than pay the cost of health care without insurance. We have 47 million dependents. We're paying for those people. They're not paying. They're not paying out of their pocket. Most of them are putting the cost over to us.
All right, let me get to another caller now. Michael from Mineola is on the line next. Welcome, Michael.
Yeah, I have a problem with the president. I voted for him, and he hasn't addressed the drug thing yet. I mean, to me, the drug should be like the Veterans Administration. You put it out on bid, low bidder gets it. I can go to Canada and buy my drugs for 80% cheaper. Today, I ordered insulin. I'm a diabetic type 2. 3 months ago, the drug was $350 for 3 months supply. You know what the price today was? $497. Oh, they can raise the price. No, I'm sorry. So the government's got to step in and say, hey, buddy, wait a minute. And you guys got to get the backbone and tell these drug companies the gravy train is over.
Okay.
It's ended.
Michael, thank you so much. Congressman, is that one of the issues that's really so difficult and so much more expensive, is prescription drug coverage? Let's tackle that at another time, or is it included anywhere in this reform?
We actually tackled that previously. You know, before you couldn't go to Canada to get the drugs. You can go to Canada to get the drugs now. One of the bills that we have passed in this current Congress, different from the last Congress a year ago, is to change that. And I agree with Michael, you know, 100%. You have the leverage in this country of using all of the customers to be able to negotiate. The Veterans Administration, with a much smaller percentage, and Canada, with 1/10 the population that we have, has used their buying power to get a better price. One of the reasons it's cheaper in Canada, or cheaper in Europe, or cheaper in Africa in many cases, is because the drug manufacturers, it costs them $1 billion to bring drugs to market, and somebody has to pay for all the research that goes in. Yeah. Once that's covered, you can then find a different market and sell it cheaper.
So all the other companies are benefiting.
That shouldn't be. There should be an equalization, and people should be able to go to the marketplace in a world economy and buy where it's cheaper. And certainly we should be able to negotiate. Michael is absolutely right on that. We have fixed that independent of this, and we're also, you should know, Michael, fixing the hole in the donut.